on that one. So for our normal or just straight mobilizations, if we wanted to say increase hip flexion, what kind of mobilization do we, or which direction do we need to mobilize? Posterior, fantastic. So for extension, we mobilize anterior, right? And I would hope that you can figure out rotations as well, yeah? If we want to increase, let's say, external rotation, what direction do we need to mobilize? Anterior. Okay? So let's start with our posterior glide for flexion and internal rotation. I'm going to have you supine for me. Okay. Now, what's the open kinetic chain, or excuse me, not open kinetic chain, my open pack position for the hip? Anybody remember?
30 degrees of abduction, 30 degrees of flexion.
Okay. So it's about like this. Okay? About like this is going to be. If I do a straight posterior move, what's happening? What's happening to our femoral head? Where's it going? Back of the acetabulum and smashing into. We got that, and then we're going to be putting pressure on that sacrum as well. We don't want to do that, right? There's not much for it to do. It's just going to get smashed in there. So, because we don't want to jam it up in there, we change. We kind of throw that, take the open pack position and toss it out the window, okay? So you can do it a couple different ways. You can come just straight on and do a we can do just a straight posterior, then we're going to decrease the possibility of just jamming it right into the acetabulum, right? Patients, I've had success with this, okay? But if we really want to avoid that posterior acetabulum and make sure that we're getting as much movement without jamming anything, then we're actually going to cross the leg, okay? And then, so we don't have to move too much, I'm going to do it on this side. And then I'm going to stabilize her pelvis. And all I have to do is lean into a posterior mode with my body. Okay? Again, I'm stabilizing the pelvis so that it's not rocking back and forth as I do that mobilization. Okay? So there's our posterior mode. And then our anterior mode, I'm going to have you flip on your stomach. This one we can get them into close to the open pack position, right? Because now I'm going to have her go into that external rotation. We've got some abduction, we've got some flexion, all that fun stuff going on. There's my position for our patient to do an anterior mobilization. Okay? Again, I'm going to stabilize her pelvis, grab onto that ASIS, and then with my other hand, I'm going to find her greater troch and I'm going to come just medial to it. Okay? Now I'm going to do just a straight anterior mobilization. Good? Yeah? Okay. And then just for straight distraction, there are a couple different ways that we can do it. I'm going to have you roll back on your back again. We can do our long axis traction. Okay? You can use the belt for it. If you want to save your hands or your arms, what you do is wrap it around like that, wrap it around my waist, and then I'm going to bring my hands in between the belt and her ankle, and as I lean back, the belt clamps down on my hands, and I can just sit back on it. I can hang out here for forever. Weeks on end. Just have someone feed me.
Hook up a Foley,
What about
a
Emily?
little bedside corner
Perfect.
behind you.
We're not worried about Emily.
No. Her leg will eventually come off.
She just has to lay there. She's not doing any work. Right?
So bed sores.
Yeah. So we're
We'll
gonna.
rotate her up to
That's right.
job security.
Yeah.
Wound care referral now.
So that's one way we can do it. Or I've had some patients where I've had success just bring them up into some flexion like that, kind of stabilize their foot. I'll grab here and just pull. that distraction. Okay? Pretty simple. Any questions on those ones?
Nope.
Okay, try them out.